Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. More top officials of government receive COVID-19 jabs as some states prepare to get their own consignment. NCDC celebrates frontline women on International Women's Day. We have the NAFDAC DG join us on the program. And millions of children in England are back in class after more than 2 months of homeschooling. It's the 8th of March and International Women's Day. The NCDC is also lending a voice to celebrate women all over the world, including the frontline workers. In a tweet, it reads that every day the women and men at NCDC choose to challenge the gender inequality that exists in health security today and every other day. They celebrate women who are breaking boundaries and protecting the health of Nigerians. In the meantime, the daily count of infection figures in Nigeria has been relatively low, as the country is barely counting an average of 1,000 daily cases experienced in December and January. In the last 2 weeks, daily cases have been around 200 and 700, except for 709 infections that was recorded Thursday and 195 recorded Saturday. Cases of fresh coronavirus infections recorded from last night was a tally of 296, and these cases were confirmed in 18 states and the Federal Capital Territory. With the latest figure published by the Nigeria Center for Disease Control, the total infection in the country now stands close to 160,000. Enugu State tops the list with 78 new infections, followed by Bauchi and Rivers. You can take a look at some of the other states and the numbers as at today. Now, according to data published by the NCDC, there is no new case for some of the other states last night. Now, according to the center, 230 recoveries were recorded last night after testing negative to the disease. The discharges today, including 80 community recoveries in Kwara State, were said to be managed in line with the guidelines. Meanwhile, over 18,000 infections are still active in the country, a drop from last week's figures of over 19,000 active cases. Well, so far, the country has tested over 1.5 million samples. Well, globally, 117 million, almost those cases, and over 2 million deaths have been reported across the world. Now, the Chief of Staff to the President, Professor Ibrahim Gambari, Senior Special Advisor to the President, Garba Shehu, Chairman of the National Drug Law Enforcement Agency, NDLEA, have received the Oxford-AstraZeneca COVID-19 vaccine at the State House, Abuja. The vaccination is coming 2 days after President Muhammadu Buhari and Vice President, Professor Yemi Osinbajo, publicly received their vaccine jabs on Saturday at the banquet hall of the Presidential Villa. The Chief Nursing Officer of the State House Clinic, Esther Ibrahim, administered the vaccine to the Chief of Staff, who says that the jab is not painful, advising eligible Nigerians to take the vaccine, assuring of its safety.
I want to first of all thank the Permanent Secretary for organizing this vaccination exercise, and also, of course, the frontline health workers here in the State House Clinic for administering it. I want to assure that my experience in receiving this was almost painless, and I'm just following the footsteps of our leader, His Excellency President Muhammadu Buhari, GCFR, who has demonstrated leadership at the highest level by being the first to receive the vaccine, followed by His Excellency the Vice President. So I'm just following the footsteps and learning leadership by example. So all eligible Nigerians should take this vaccine. It is safe and it is painless, and the benefit is immense because it's not just for the individual, but the more Nigerians that are vaccinated, the more we develop the herd immunity, which will keep our country safe and our people healthy.
And just a couple of hours after that, members of the Presidential Task Force on COVID-19 took the shot of the Oxford AstraZeneca vaccine. The PTF was established by the President March 9, 2020 to coordinate and oversee the country's multi-sectoral intergovernmental efforts to contain the spread and mitigate the impact of the virus, the pandemic in Nigeria. Now, the PTF team includes the National Coordinator, Sani Aliyu, former head of Nigeria's AIDS agency, NACA, and also the Minister of Health, Dr. Osagi Hanire, Minister of Information and Culture, Minister of Environment, Minister of State for Health, Director General of the NTBC, the National Incident Manager of the PTF, and many others. According to the chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, he says Nigerians should not be afraid of taking the jab because it will reduce the number of infected persons in the country.
Local measures as may be permissible under the laws and other international obligations which we are expected to discharge. The NCAA will further make announcements to this in due course. Finally, let me
Well, to some other stories, the Lagos State Safety Commission has sealed not less than 11 facilities, talking about event centers, lounge, nightclubs, among others, for contravening the COVID-19 safety protocols. The safety administrator, Wale Adeboje, says the facilities were sealed for non-compliance with COVID-19 health protection regulations of the state and that of the federal government, and also as well as the non-compliance with the event safety clearance that was issued to them by the Commission. He also says the agency will continue to carry out enforcement exercise and punish violators, urging event owners to register and obtain permission before going ahead with their ceremonies.
50 people maximum indoor for any enclosed space. And we visited a couple of places and found out that quite a number of people actually flouted the rule. The people are not complying. And even when quite a number of them have applied for event safety clearance, we still notice that some of them even were doing double the number. And they did not in any way comply with even the numbers that they were supposed to do indoor and even outdoor. So, the people were not using face masks. So even after we seal the facility and then make them to face the penalty and sign an undertaking, and we unseal, if that facility is still ours again, we will not hesitate to reseal the facility. They will be penalized. We have an enforcement team enforcement unit that will take care of that. They will be penalized, and then they will be made to sign an undertaking.
Well, joining us right now is a Nigerian pharmacist and professor, Mojisola Adeyeye, also the Director General of the National Agency for Food and Drug Administration and Control, NAFDAC. She joins us via Zoom on the program. We'd like you joining us on the program as, of course, we celebrate this very important day, especially women in leadership under the COVID-19 world. Thank you for joining us on the program.
Thank you very much. It's good to be here.
All right. I'd like to begin, Prof, by asking first about the vaccine, the Oxford AstraZeneca vaccine. How did NAFDAC arrive at the safety and efficacy of it? And this is on what, perhaps what we've heard, because we understand that Covishield, with patent right from Oxford AstraZeneca, was only tested among the ages of between 18 and 65.
Yes, NAFDAC has been on this journey since April of 2020, and we've been studying with others about the vaccines that were going to come down the road later in the year 2020. And we started following up as soon as the first vaccine was approved. We got the assessment report of the vaccine, the first one, Pfizer-BioNTech, to know what they actually reported from the assessment, that is from US FDA. And we kept following because we were also waiting for the dossier, which is the application package. We had to run after the dossier, meaning we weren't waiting at all for the manufacturer to bring it. We went after them, went through the Central Africa or Africa representative of AstraZeneca, and they finally connected us to Serum Institute in India through meetings, a couple of meetings. They then agreed that they will send us the dossier. And our work began, or continued rather, after we got the dossier, having done some preliminary work from other people's assessment, other agencies' assessment. So we got the dossier February 10, and it is all about science. There is nothing there that doesn't involve science. So we have our COVID-19 vaccine committee together, and they did excellent job. It took 5 working days to review, and why it was so fast was because we use what is called reliance, meaning other more matured agencies have already, approved, like UK, like European Union, and we got the assessment report just like we did for Pfizer-BioNTech, and that formed the basis of why we should do the expedited review. That was how it took 5 days, 5 working days to review. And the rest is history. Well, the rest is history, but we needed to get the vaccines into the country. And the NAFDAC has to actually exempt the vaccines from testing in India, because Serum Institute is in India. So we have to give an exemption, because we put a hold on any product that is coming from India or China, just to be sure that we do pre-shipment testing. But because of the approval that we gave to the AstraZeneca vaccine, we gave what is called CRIA exemption. So that facilitated the vaccines from getting to Nigeria. And then our work continued, because we have to now check the vaccines in through our Port Inspection Directorate to ensure that the clearance is well done. And we also used what is called track and trace, or a GS1 technology-driven traceability, to follow the vaccine using barcoding. Meaning, when we check the vaccines in, we did the scanning. It took about 10 hours to scan about 8,000 boxes for our staff to finish all the barcoding checking, which means we have a reference template. Therefore, if any of the vaccines travel to anywhere in the country, we will follow it based on the track and trace. So we've been very, very busy since the arrival of the vaccines. And it's not just the vaccines, being track and trace. We have to monitor any side effect, from, soreness in the arm to maybe a slight fever or tiredness or whatever. We need to document it, because that is what all regulatory agencies in the world are doing. Because bear in mind, we gave emergency use authorization. It is not a full licensure. So we have to continue to collect data with all our colleagues, regulatory agencies across the world, so that we compare data and accumulate data to make sure that the vaccines on the long run can be licensed. So the pharmacovigilance or safety monitoring continues as we speak.
All right, Prof, we're going to come back to you, especially asking if indeed there were tests carried out with the variants of concern that we're seeing around the world. But this is also to say that breaking news, Ogun State has become the first state to take delivery of the COVID-19 vaccines. This is, of course, receiving its own portion. We understand that it's about 50,000 doses of the vaccines that it is getting at the moment. So that's Ogun State there receiving its first dose of the COVID vaccine. Still on the vaccine and vaccination, when a drug is reproduced, what the Serum Institute in India are doing, are there not bound to be variabilities which affects the standard, quality and efficacy? And this is talking about COVID.
Yes. Serum Institute of India got the license or sub-license from AstraZeneca, Oxford University, to reproduce the vaccines. And AstraZeneca, Oxford University gave them all the documents that they needed, or did what is called technology transfer. And Serum Institute is one of the biggest manufacturers of vaccines in the world. So they know what they are doing. And I don't think it was a big problem or big issue for them to follow the procedure and maybe adjust here and there in order to be able to reproduce what was given to them, the procedures rather, what was given to them by AstraZeneca, Oxford University. So the test, is all science. You follow the instructions, most likely you will get the same results. If the instructions are not followed, very likely they will not get it. But Serum Institute, I believe, got it very well.
So if we look at the variants of concern, the B1351, the P1, the B117, and even the Nigerian one, the B1525, I mean, the common mutation they share is the E484K, believed to enhance the variants of concern, to even escape vaccine triggers, antibodies. If this is present in Nigeria, did NAFDAC test COVID against any of the variants?
Actually, that is not what NAFDAC does. There are specialty labs in the country. You have NIMA in Lagos, NCDC, and you have the Center of Excellence in Redeemers University in Ede for genomic testing. So those three labs have been working on testing for the variants in Nigeria, and they found out that Nigeria has the B117, the UK variant, that we don't have the South African variant, at least not yet. And the South African variants are the ones that actually reduce the efficacy of the vaccine. The UK variants do not have impact on the efficacy of the vaccines. So to answer your question, NAFDAC does different types of tests. Those three labs do the genomic. They have to do the genomic sequencing to find out the type of mutation or the type of variants that are coming up, and to know whether such variants will affect the efficacy or not. But thus far, what they found out is that the efficacy of the vaccine in Nigeria as of today will not be impacted by the variants.
We understand that about 80 to 90% of Nigerians are asymptomatic. Reports show that COVID with patent right from AstraZeneca is not effective at preventing mild to moderate infections based on the South Africa study and the others. I mean, so if this really is the case, of what importance is it then to sort of roll out COVID?
Well, the efficacy of any of these vaccines, again, like we said before, will depend on whether the variants are impacting or not. But for COVID shield, just like any other vaccines, in South Africa, it reduced the efficacy. In Nigeria, at least for as of today, there is not going to have any impact on the efficacy. But because most of the people, or many of the people actually, that have the COVID-19 infection are not symptomatic, they are asymptomatic. That doesn't mean that they should not get the vaccine, or if I get you right. Because what the vaccine does is to protect against falling ill, meaning getting to the hospital. One can still be infected if one doesn't have doesn't have the precautions, the non-pharmaceutical precautions, using the face masks, washing of hands, and social distance. The person that gets vaccinated may still be infected if that person is not well protected, or he doesn't protect himself or herself. However, that person will not get seriously ill. They may get a little bit, but it's not going to feel a little bit unwell, but it's not going to result in hospitalization. And that is a big thing, because the way each person handles this virus is different. Some people may have it and then they just fight it off. Some may have it and then it may result in death. So it's better to have one's protection by getting the vaccination.
All right, Prof, the final question, and you have about 1 minute to answer it. It's slightly two in one. One is, would you recommend the COVID shield, with patent right from AstraZeneca, for people aged 65 and above? That's a yes or no answer. And the second one is, states have started getting, the portions like Ogun State. What are your expectations as to prevent waste and, of course, for storage?
Yes, people above 65 can get the vaccine. There have been a few reports here and there that is not effective for people above 65, but those have been reversed because people, I believe there were a lot of testing that took place, and they found that over 65 and above had good immune response. So people above 65, yes, they can get it. Your second question, please. Sorry.
The second one is with regards to states that are receiving the vaccines. What are your expectations to storage and preventing waste?
Actually, the federal government doesn't send vaccines to any state until that state is well prepared, until they confirm that the state is well prepared. So Ogun State was sent its own portion because they have confirmed that Ogun State is well prepared. Well prepared in terms of having the cold chain maintenance, meaning they have the freezers, they have the backup just in case there is no power. So federal government will only send to states that are prepared so that they can avoid the waste.
All right. We appreciate your time on the program. Professor Mojisola Adeyeye, Director General, NAFDAC. Thank you for joining us on the program.
Thank you so much, and have a nice evening.
To you as well. Meanwhile, millions of children in England are back in class after more than 2 months of homeschooling. Primary schools have fully opened for all pupils, while secondary schools will have a phased return to class. Secondary school pupils in England will take regular rapid COVID tests and need to wear masks in class. Prime Minister Boris Johnson has described the return as an important first step towards a sense of normality. Indeed, don't forget to protect yourself, wear the face mask, continue to wash your hands, of course, until the vaccines get to you. You can take responsibility and see more updates, a better understanding of the pandemic on our website. There you have it, channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.